everyone. I'm Nick Hysmith, Medical Director of Infection Prevention at Le Bonheur Children's Hospital and one of the Associate Professors of Pediatrics at the University of Tennessee College of Medicine. Just to give a little bit of an update of what we've seen over the last week in the pediatric side, I think that just as been alluded to already, we've seen the number of severe illnesses in children continue to increase. We had been watching this for the past several weeks as we had seen what happened in some of our surrounding areas, such as in Arkansas, in Mississippi, and as well as Louisiana. We had been preparing for an increase in our pediatric admissions here in the Mid-South. I think, unfortunately, that is what we've seen over the last 2 weeks. We have seen the number of children presenting to our emergency department who have symptoms of COVID-19 increase. We have seen the number of children who have presented to our emergency department who are tested for COVID-19. We've seen the positive rates increase to almost 30%. So we are seeing sick kids, we are seeing them come to our emergency department, and we are seeing them admitted to our respiratory floors and also to our critical care units. This is a drastic change from what we've seen previously in the pandemic, where for the most part kids were admitted with other illnesses and were found to have COVID-19 incidentally. We are now seeing kids with respiratory symptoms, shortness of breath, requiring oxygen, supplemental oxygen to be given to them, as well as some kids who have required intubation and management in our intensive care areas. This has been sustained over the last week and a half, and unfortunately I do not see that this will decrease over the next several weeks. And there are a few reasons for that. Many of those have already been mentioned, but I'll reiterate them because I think they're all three coming together. We have our unvaccinated population here in our area, which includes those who have had the ability to be vaccinated, so those that are 12 and over, and those who have not yet had that ability, so those that are less than 12. We also have seen the Delta variant become the predominant strain in our community. We know that it's more transmissible, and it seems to be having more of a severe effect in our pediatric population. And then lastly, or third, we are seeing some of our school systems start back. So in Arkansas, we've seen our school systems go back there. And we anticipate our schools will be going back in person over the next several weeks. So I think that these three things in combination are leading, unfortunately, to what we're seeing in our pediatric population, and I don't suspect that that's going to change over the next couple of weeks. I think that what has already been reiterated are the best ways for us to prevent this from happening. Everyone that should have been vaccinated up until this point, so those that are 12 and over, if you have not done so, please get vaccinated for our parents as well. And continue to wear masks in the settings where there are groups of people gathered. I'm hopeful that as we move into the next several weeks and the schools continue to discuss the mask requirements there, that we will have a little bit more of a understanding of the ways to keep our pediatric patients, our pediatric population in this community safe.